Well, welcome back, everyone. You know, keeping your kids' teeth clean and healthy is top priority. And here to talk about that is Mary Wiechart from Wiechart Dental Smile Studio in Spencerville. Welcome, Mary.
Hello.
All right. So we all want to make sure that we're doing the right things to keep our kids' teeth, you know, healthy as can be. So let's start from the very beginning with infants.
Yes. So when kids are starting as soon as they're born, you can start taking a washcloth, a clean washcloth or gauze, and rubbing it around their mouth and keeping all the residue out of their mouth. It also helps them get used to you getting in their mouth. And then after they get teeth, the ADA actually recommends by 1 that they see a dentist, whether or not they have teeth. Tooth eruption kind of varies. There's a year variance on that. So I always tell parents, don't get too excited if they don't have teeth. They will come in eventually. Usually the bottom 2 come in first. But as soon as they get teeth, you want to start brushing them. I know that seems crazy, but it is important. Again, not only to get them used to it, but to keep them nice and healthy. You can use toothpaste if you want, and even use a fluoride toothpaste. I also recommend you just take the tube and get it right to the edge and just smear right on top of that. You do not need much.
Okay, so keeping you know, the kids' teeth clean and healthy, you know, that's something that a lot of people want, of course. But you know, some people think, well, they're not the permanent teeth.
Yeah.
So tell us about that.
Yeah. So I hear that a lot, actually, and you know, a lot of these baby teeth that are coming in, you're going to have them until you're 11 or 12, so they are very important. And I kind of think of them like a bench warmer for the adult teeth. So if we're not having them in our mouth, the teeth shift and change, and there might not be space for those adult teeth to come in, causing issues later on.
Yeah, and so I would think that would also be important for the gums as well, right?
Yes, yes, yes.
Yeah, so keeping the gums healthy is something. But also, if you're kind of, you know, teaching the kids, it's all about teaching, right?
Yes,
at a young age, you want to teach the kids how to keep their teeth and their mouth and their gums and their tongue and all that clean and healthy, I'm guessing, right?
Yeah, yeah. So when you're brushing kids' teeth, you really want to make sure you're getting the front along the gum line. That's the most common spot for cavities. And then those back teeth between the teeth, most importantly. So even start flossing, which I know seems crazy again. They're just baby teeth. But between those back 2 baby molars is the most common spot we see cavities. So I always tell parents, you know, you want to start flossing as soon as they get teeth, again, to get them used to it and then to prevent those cavities as well.
Yeah.
And that helps with the gum health as well.
Right. So it's all about teaching. Now, what about if they, you know, toddlers, you know, they can be kind of ornery. So sometimes they might fight back. So what do you do about that?
Well, as the mother of 3 boys, I know about that. Sometimes it becomes a wrestling match, but that is okay. With toddlers especially, my 1-year-old right now, sometimes if he's really fighting me, I'll put him between my legs and put his arms underneath my legs, and then I have perfect access to brush his teeth like that, and they tend to not fight you as much. But really, the key is consistency, because the more you do it, the more they get used to it. Like my 6-year-old doesn't fight me at all anymore. He just opens up and lets me brush.
I mean, that's always a good thing. So, so you know, now that you're teaching them and you're actually doing the brushing, so when should you stop and have them do the brushing?
That is a great question. And probably one of the most common things I see is parents let go of checking their brushing too soon. So children do not have the ability to brush their teeth properly until they can write their name legibly. And again, as the mother of 3 boys, that takes some time. Usually around 8 or 9 is the average time, but even then I always tease my own kids, I'm gonna be checking their teeth until they're 20, because until you're confident they're brushing well enough, you should not stop checking their brushing.
Right, exactly. And it really, you want to teach them when they're young, right? Because it becomes good practice for later in the years, and that's something that, you know, we always talk about brushing your teeth and flossing, but do you think a lot of people do enough flossing?
No.
Probably not. I'm guessing probably not.
They might tell me they do, but I don't think they do.
Yeah, exactly. But, you know, just on a side note, if you don't, you know, keep your mouth and gums and teeth and tongue and all that healthy inside, it can lead to a lot of health problems in the future as well.
I was on here before talking about a new study that came out about the relationship between, you know, gum disease and heart attacks and stroke and all that. And it's crazy. The studies just keep coming out, all the things they're connecting it to. It seems to be related to that, like chronic low-grade inflammation. If you have that long-term, it causes issues throughout the rest of your body. So teaching them young is the best place to start.
All right, start out when they're young. Well, Mary, I appreciate you coming on and giving some great advice, you know, for those, especially for those parents, new parents, I should say. Yeah, and just a reminder, brush those teeth, brush the teeth. All right, thanks for coming on.
Thank you.
All right, well, don't go away, because medical news is coming up next.